One of the things I see as a practicing dentist, and I've been seeing this for the better part of almost 20 years in practice, is that people have a lot of confusion about oral hygiene. And I can't emphasize how important it is for you to do a good job on a daily basis in order to, number one, avoid trips to the dentist that require a lot of money, a lot of time in the chair, and a lot of frustration with any kind of dental care. So if you can make a small investment every day in your dental health by brushing and flossing correctly, it will go a long ways towards avoiding issues. So let's go over some of the techniques for flossing and brushing that really make a difference. Okay, I've got a model here, and this demonstrates how to properly brush. I've got this brush. Now, when you're brushing your teeth, you want to make sure that you get the brush angled 45 degrees to the gum line. Okay, and the thing that we're trying to remove from teeth is bacteria. Okay, and it's called dental plaque. So if you could imagine that your teeth are kind of like a chalkboard, and the brush is an eraser. Okay, so what you want to do is you want to erase all of the bacteria off of these teeth, and you specifically want to get up underneath the gums. So when you're angling the toothbrush underneath the gums, you want to make sure that you push up there. You're not going to hurt your gums, believe me, they're tougher than you think. And just get in there and paint little circles. So in your mind, just kind of count 1, 2, 3, 4, 5, and then move a tooth. 1, 2, 3, 4, 5, and move a tooth. And you're going to do this over and over, moving tooth to tooth to tooth. And you're going to go all the way around, again, getting underneath the gum line. You want to make sure you feel the bristles under there, because the bacteria that gets underneath the gum line is what causes the inflammation that leads to periodontal disease, gingivitis, and also cavities. So you want to work all your way around, and then you want to go inside, and you want to do the same thing on the inside, what we call the lingual surfaces. And you want to paint 5 little circles on each one, 1, 2, 3, 4, 5, and just keep moving along. When you get to the front, angle your brush vertically, again, getting underneath the gum line. Okay, and then when you're done, you want to scrub the surfaces of your of the tops of your teeth, what we call the occlusals, and you want to go ahead and move all the way around. Do the same thing for the bottoms. Okay, now as far as bad breath, one of the most important things you can do is brush your tongue. Okay, so make sure you get that toothbrush as far back as you can, and then scrub that tongue real good. If you see in the drugstore, they also sell some little things called tongue scrapers, and a lot of the bacteria causes halitosis or bad breath are located at the base of the tongue, back near the throat. So the further back you can clean, and what you do is just stick your tongue out as far as you can and just scrape it as far back as you can. Okay, now one of the most important things that people neglect to do is floss their teeth. I believe that is the single most important thing you can do to maintain your dental and oral health and your systemic health, how that contributes to your overall health at the highest possible level. Okay, so flossing your teeth is really critical. You do it once a day and you do it right, it'll pay big dividends. Okay, basically the floss, okay, is a it is a difficult process for a lot of people. I understand that. Okay, but what you're doing is you're getting in between teeth, okay, and keeping them clean, and that's really where most of the decay and bacteria will reside, is in between teeth and underneath the gums in between teeth. And with the floss, what you want to do, what a lot of people will do, if you can imagine my fingers are like teeth, is a lot of people will put floss in and they'll saw it back and forth. Okay, and basically with floss, you want to clean up and down. You almost want to wipe the surface of the tooth clean, and you want to do that for both sides. Okay, so you want to go up and down and up and down. So you want to get both teeth in between contacts. Make sure you clean on those surfaces. You almost want to hear your floss squeak. Okay, one of the things that a lot of people will use, and I've been recommending these for years, is these little floss picks. They make all kinds of varieties for them. But basically what this does is allows this process to become a one-handed deal. And I've been told that people can get their teeth flossed in less than a minute with these things. So what these things will do is you can basically get your teeth flossed by getting the floss underneath. Again, remember I told you, it's up and down. Okay, on one side, and then up and down on the other, and you're pulling. Okay, you want to go below the gum line. You don't want to go side to side. You don't want to do this kind of thing. You want to go up and down. Okay, up and down. You want to hear those teeth squeak. Okay, up and down, and you want to work your way around all of the teeth. Okay, and then behind the last tooth, you want to make sure you clean under there. Okay, now one of the things that people ask me about when it comes to things that I recommend as far as electric toothbrushes is the Sonicare is one thing that I've recommended for years, and I actually been using it, and my family uses it as well. And I think this is a great tool. It doesn't substitute for the flossing. That's the most important thing. But I have patients who will say, Doc, I'm not going to floss. What would be something that I could do to maximize my ability to stay clean? And I always recommend this thing for any patient, really. One of the things that I found in my house, I've got young children, and they like to walk around and brush their teeth with this thing because if, and I'm going to put this up to my microphone so you can hear. Basically, the thing that distinguishes the Sonicare from all other brushes is the ultrasonic vibration of the bristles. And so, you know, it behaves a lot like our dental instruments do, the ultrasonics that we use to clean your teeth. In fact, a lot of people, when they get their teeth brushed with a Sonicare, they remark that they are getting a sensation like their teeth are being cleaned on a daily basis. And it really massages your gums, really forces a lot of water through the contacts, and helps your teeth stay clean, and it's wonderful. So this is something that if you're inclined to buy, they sell them at all the warehouses like Costco, BJ, Sam's Club. You know, ask your dentist. A lot of dentists carry this in our office. We carry it in our office, and we sell it for basically what the warehouses sell for. And the only reason we do that is to make sure that people get the best chance to maintain themselves as healthy as they can. Okay. As far as mouthwashes, a lot of people will say, well, you know, I use mouthwash. What's the impact? And mouthwash is great to the extent that it helps you get that fresh feeling and feel good about your mouth. I wouldn't say that mouthwash is something that substitutes for any of these things that we just talked about. Again, the most important thing that happens is not the cleanings necessarily that you're getting from the dentist on a regular basis, although those things are very important, but what happens day to day. And what you're doing is you're removing bacteria. And that bacteria, when you're removing it on a regular basis, I can guarantee you that you will minimize the incidence of periodontal disease, gingivitis, and gum disease, as well as cavities. And the big factor too that we're starting to see in research is that it contributes to overall wellness. You can also improve your heart health. You can reduce the incidence of a lot of diseases like diabetes and even Alzheimer's. A lot of diseases are tied into the inflammatory process that occurs when you do get gingivitis, periodontal disease, those types of processes. Hopefully this information helps you. Again, you know, visit our videos, trying to help you guys help yourselves, and I think that's really where it's at. Remember, life's better with a smile. Thanks for watching.